I'm told the flu has spiked. Hospitals are seeing double the number of patients with the flu, now more than in December.
Patients being admitted into hospitals with the flu now making up for what doctors say was a slow start to flu season since the season began on September 29th.
We have had over 400 positive cases this month alone, and that's double December. So we're over double, and we still have a few more days left in January. We're seeing anywhere from maybe 20 some positives to up to over 50 a day this month. So definitely a big month.
Dr. Paul Richardson, the chief medical officer for Conway Medical Center, tells me they had a quiet beginning of the flu season, not seeing many patients with the flu from October to November. In December, the number began to increase. Then January, he says it's really ramped up.
You know, we think, okay, well, flu is not a big deal. And in many cases, thank God, it's not a big deal. However, right now we have about 8 patients admitted with complications of influenza, and we currently have 3 patients admitted with complications of COVID. So these viruses are real. They are out there.
South Carolina Department of Health reported its first pediatric flu-related death of the season Friday. DPH also reports from January 12th through the 18th, there were 606 flu-associated hospitalizations reported by 64 hospitals, 5,711 lab-confirmed tests were reported, and 11 flu-associated deaths. KidCare Pediatric Urgent Care in Conway ran out of flu tests, telling me they're treating 30 to 40 kids daily for the flu. The Pediatric Urgent Care saying they should have a new shipment of tests today.
If you think about your elderly patients or your patients that their immune system may be compromised, sometimes in very young children, these kind of things can be quite devastating. So I just want folks to take it seriously.
He encourages everyone to take precautionary measures such as staying home when sick and washing hands regularly. In studio, Caitlin Richards, ABC 15 News.
Caitlin, thank you. Dr. Richardson says it is still not too late to get a flu vaccine as flu season runs through May. He says to speak with your healthcare provider about getting that vaccine.